Good morning, everyone. So I'm officially start. Good morning. And I would like to warmly welcome all of you to this conference on hospital accountability and tax exemption. And thank you for joining us to discuss one of the most important and timely issues in health policy. Nonprofit organizations are expected to create public value, address unmet needs, and making the community they are serving more stronger. Their legitimacy depends not only on the services they provide, but also on the broader social good they generate. This expectation is more evident for nonprofit hospitals. In exchange for substantial tax exemptions, nonprofit hospitals are expected to provide meaningful community benefit that improve public health. For decades, legal scholars and health policy researchers have emphasized that hospital accountability is shaped not only by federal tax law, but also by state policies and enforcement mechanisms. Across the country, states have adopted different approaches to regulating charitable hospitals, including minimum charity care requirement, financial assistance policies, reporting and disclosure requirement, and other public accountability measures. While some states primarily emphasize transparency, others establish minimum standards for charity care and financial assistance. At the heart of these policies is the principle of social responsibility, the ethical and political obligation for nonprofits to use their resources to improve community well-being. For nonprofit hospitals, this responsibility extends beyond providing clinical care. It requires investing in the upstream social and environmental conditions that shape health and addressing the needs of the communities they serve. An important policy questions therefore remain: do nonprofit hospitals provide community benefits that address their social accountability and justify the tax advantage they receive? Research suggests that the answer depends, in part, on the strength of public policy. Reporting requirement alone is not enough. Effective accountability requires clear definition of community benefits, standardized reporting, meaningful evaluation, and measurable outcomes. Equally important is ensuring that community benefit investments reach the populations with the greatest needs. Social responsibility is not simply about spending more. It is about investing strategically based on community health needs. Partnership are also becoming increasingly central to the future of nonprofit hospital accountability. As America Essential Hospitals has noted, financial reports alone cannot fully capture the public value created by maintaining access to essential services regardless of patients' ability to pay. Better data collection, standardized reporting, and rigorous evaluation are essential for understanding how community benefit investments translate into healthier communities. The next generation of community benefit should be partnership driven, prevention focused, and tied to measurable improvements in population health. The strongest justification for nonprofit hospitals' tax exemption status is their ability to improve health. Although the impact of community benefit spending varies depending on how resources are allocated, growing evidence suggests that strategic investments can produce meaningful improvement in health outcomes. Collectively, nonprofit hospitals report approximately $150 billion annually in community benefit spending. At that scale, Community benefits should be viewed not simply as charitable spendings, but also one of the nation's largest health investments portfolios. The challenge before us is ensuring that these resources are directed where they can generate the greatest return for population health. The evidence points toward a clear conclusion. Nonprofit hospital accountability requires a stronger definitions of community benefit, greater transparency, standardized and comparable reporting, better alignment with community needs, rigorous evaluation of whether tax benefits are justified, and a stronger focus on measurable health outcomes. Today, we are fortunate to have an exceptional group of experts representing government, academia, health system, nonprofit organization, and policy research. Our speaker and panelists come from organizations including Sonia Phillips from U.S. Government Accountability Office, George S. Benjamin, American Public Association, Nancy Lim, Catholic Health Association, Deirdre Griffith, BJC Health System, Robert Knoll, America Essential Hospitals, Judy Garber, Lone Institute, Eleanor Pater-Brook Institutions, Zachary Levinson, KFF, Misha Shah from 32BJ Benefit Fund, Eva Stell, Undue Medical Debt, Caddy Coach, Peterson Foundation, Tatiana Santos, Tulane University, Bradley Herring, University of New Hampshire, Jill Manning, New York University School of Law, Ann Kampelski, I call her our colleagues at Hopkins, and Gerard Anderson and Judge Sharfstein from Johns Hopkins Bloomberg. I apologize if I unintentionally omitted someone. Our program today includes 2 keynote speakers, one in the beginning of the morning and one in the afternoon, as well as 3 panel discussions. Session 1, we will focus on hospital industry, policy, mission, and accountability. For session 2, we will focus on nonprofit hospital tax exemption and financial realities. And in session 3, we will focus on nonprofit hospital community benefits and social responsibility. Thank you again for being here and for continuing to this important conversation. Also, thank you to the Johns Hopkins Nexus Award and Arnold Venture for supporting our research. It is now my greatest pleasure to introduce our first keynote speaker. Everyone know him, Professor Jerry Anderson. Professor Anderson is one of the nation's most distinguished health economists and health policy scholars. His work has focused on healthcare payment reform, hospital finance, comparative health system, and health policy in the United States and around the world. On a personal note, I have learned a tremendous amount from Professor Anderson over the years, and I continue to learn from him today. It is truly an honor to welcome him as our opening keynote speaker. Please join me in welcoming Professor Anderson.